Hello guys, very good evening to all of you. And guys, today's session is all about the NEETPG exam that has been recently concluded. And shortly I'll be joined by Dr. Sakshi ma'am.
Ma'am, thanks a lot for giving your valuable time for this session. And the students are really fortunate enough that we can talk with you one-on-one on this. And I had been telling them about what this session is all about. And at last, I've told them that we'll take some of them live and they can come live with us and clear their doubts as well. And first of all, I told them that we'll be dividing the session into two halves. First of all, we'll talk a little bit about those who have got good ranks, but still there are some ifs and buts with regards to how to, choose a branch. So first of all, ma'am, the first point is about, I'd like to ask you, please enlighten us. Suppose there are students who have got good ranks. They're getting their branch of choice, but they're not getting their place of choice. So should they sacrifice their branch of choice for place of choice?
Sir, I think everyone would agree with me that it is always the branch of choice which matters the more than the place of choice. Branch of choice is like your spouse who's going to stay with you throughout your life, right? Yeah. So a branch of choice should always be kept above than the place of choice. You have to live with that branch of choice. So always it has to be branch of choice.
Yeah, so that's part is sorted out. Second thing, ma'am. Second, this one is a little bit more important. And throughout the years, we as faculties, we do get this doubt. Suppose there is a student who is not getting MD, MS, clinical branch of choice, right? Now, there are two options. That student can go for some other clinical branch or DNB diploma. Let us say, for example, someone wants medicine or OBGY. If he or she is not getting that, should she or he take anesthesia as a branch or take DNB or diploma of medicine or OB? I mean, medicine diploma is not there, but DNB of medicine or
sir, I'll divide this into two parts. DNB versus clinical branch as DNB anyways, always. I mean, if you are going for DNB, that's a very good option. This perception that this is a wrong perception which many students have कि DNB नहीं करना चाहिए, that's a wrong perception. So if you are getting DNB in surgery, if you are getting DNB in medicine or DNB in OBGY, please go for it. They are very good options for you. These degrees are very much recognized in India, not only in India, abroad. And one very big advantage, sir, which I see amongst DNB students is they get a lot of hands-on practice, which MD/MS students don't get. And ये जो था ना सर, जो पहले था ये wrong perception, ये पहले होता था कि DNB clear करना is difficult. You know, clearing DNB was difficult. This has changed now. Now clearing DNB is not difficult. You can clear DNB easily. Obviously, if you compare it with MD/MS, yes, it's a little difficult. But then you can clear DNB. DNB, if you are getting DNB in medicine or in surgery or in OBGY, please go for it. You shouldn't think twice about it unless and until you are very sure and very, you want to prepare again for the NEET exam. You know, if you are among those students who are highly motivated that next time I'm going to give the exam, like we had a topper this year who was so sure, I think he was rank 3, Dr. Rohan was taking his interview, or Dr. Abbas, and he said that he got a very decent rank in NEET, but he wanted only radiology. So he dropped 1 year, he prepared for that 1 year, and then he is rank 3. So if you have that kind of motivation, please, then in that case, don't take DNB. But otherwise, DNB, whether it is medicine, surgery, pediatrics, it's very good. DNB, orthopedics. Now, so second question which I keep on getting throughout the year is DGO. DNB versus DGO. So DNB versus DGO, so DGO stands nowhere in comparison to DNB. Okay. There are so many DGOs which are being offered where the degree, the diploma degree is not recognized elsewhere. So please, unless and until you are a second attempter, third attempter, and you are like, I cannot prepare for NEET anymore, then in that case, go for DGO. Because at least you will be a DGO. And in your clinical practice, it will not much matter if it's your private practice. In corporate hospitals, it is going to matter. In your medical colleges, it is going to matter that whether you are a DGO or whether you are an MD/MS candidate. I'm not saying DGO is the end of the road. No. If you do DG and DGO, then you can also go for secondary DNB. That is again a 2-year course.
Now,
And you can
exactly.
again substantiate. Right?
Some people, they do argue this, that it is like, should I go for DNB or should I go for a recognized diploma, then go for secondary DNB?
So always DNB is better than going for DGO followed by DNB. Okay. But in case you are, you want a clinical branch and the choice is between DGO and a secondary DNB and a paraclinical or a non-clinical branch, then I would choose DGO and DNB over a paraclinical or a non-clinical branch, because that is my perception. I mean, because I want to remain connected with patients. But I'm sure, sir, you can answer this question also, that what is the scope of taking a paraclinical or a non-clinical branch, whether students should go for it or start preparing again?
Now, I'll tell you, in fact, just 1 week back, I got a message from a student who has picked MD Pharma because of pressure from his parents to get rid of the preparation phase, earn something and be done with this preparation phase and pick up at least something.
Right.
So he picked up pharma. He's now 2nd year resident of pharmacology. And he messaged me, sir, I am depressed every single day. I have to push myself to go into the department because I don't love pharma. I have an identity crisis. I don't know. I no longer know, am I a doctor or what? And I see at the clinical people in my medical college, and I see why not me in their place?
Right.
Right. And so I'll tell you this, if you want to pick pharma and add physio, they do not have any patient interaction. Right. So you'll have identity crisis if you don't love the branch. If you love the branch, then you'll not have an identity crisis, because a lot of people, they ask me what I do for a living. And believe me, guys, it is very difficult for me to make them understand. So when I say I'm an MD in pharma, they say, okay, I'm a pharmacist, why based? So I never feel bad. Because I love my branch so much that I don't need to see my happiness from other people's eyes. And that is because, I love the branch. So if you have so much of love for a branch, and second thing is, if you don't like clinicals, कई बार होता है ना कि मतलब गलती से सवार हो गए नाव में, अब नाव में सवार हो तो कभी आप करें क्या? तो अगर गलती से नाव में आ गए हो, then in that case you can pick pre-para clinical. Otherwise, don't go into pre-para until and unless you love the branch. Having said that, pre-para में मैम थोड़ा सा ये है कि पैथो और माइक्रो में फिर भी थोड़ा सा ना clinical link होता है. People, there is still some clinical aspect in patho and micro. So people, they do sacrifice the clinical branch and they go into patho and micro. Again, it is subjective to the person, right? So if a person has prepared for 2-3 years, and then there are a lot of factors, family pressure, financial pressure, etc., then one can think of those. But if one goes for anat, physio, pharmac, where there is little to no clinical interaction with patients, it tends to be depressive. So this is what we talked about those students. So guys, please do ask us your doubts at last. At last, we'll cover all your doubts. In fact, we'll take some of you live along with us, and you can ask your doubts in the live session as well. And now, so this is the first category of students who have done well. They're confused. Second category who have not done well. They're not about to get anything from this exam. And the first thing is that, they will try to do something, right? What to do, we'll discuss about that. But whatever we will advise them to do, the first question, the first doubt that you also might have got, and I also got from a lot of students, is now I have a sense of vacuum around me. समझ नहीं आ रहा मैं क्या करूं, ऐसा लगता है कि एक दीवार है आसमान तक और आगे कैसे जाऊं समझ में नहीं आ रहा. So that feeling of vacuumness, how should they even think of starting back, coming back to the groove and start to think about anything for preparing?
Sir, to think about coming back is to come back. The longer you think about coming back, you are more going into that cocoon where you will take time to come out of it. The best way to come out of this is to bounce back into it and set a target. And so you were saying that there are students who are thinking what to do. Now, in this case, we should divide the students into 2 categories. One is those students who have got rank up till 25,000, so students who are between maybe 15,000 to 25,000 who are thinking, what should we do now? And students who have got rank below 25,000, right? So 35,000, 40,000, we should divide the students into these categories, and then let's discuss that what should be the way ahead for these students. So, sir, I feel that students who are within 25,000, number one, if your rank is between 14,000, 17,000, 18,000, and you are a second or a third attempter, rank between 17, 18, 15,000 definitely gives you a DNB in a reputed institute, right? So it's not that you will be going to some peripheral institute. So you will get DNB in a reputed institute if you have got ranks between 14,000, 17,000, and you are not getting MDMS, you are wanting OBGY, surgery, pediatrics, or medicine. My advice to you would be, if you are a second or a third attempter and you don't have any motivation now to study again, please take up DNB in a reputed college. That is my advice to students who are second attempters and third attempters. But if you have got rank 17,000, 18,000, or up till 25,000 along with internship, then I believe that you should again prepare. And you should not only target NEET or next, whatever is going to happen in 2024, which I'm sure, sir, again, we will have to address this question. Just now also I saw ki ma'am, NEET hoga ki next hoga, right? So we will be addressing this, how to go about. But if you are a first attempter and your rank is within 25,000, please target INI set of in May the 2023, the INI set which is going to happen, please target that, right? And sir, we will discuss with them how to go ahead with, if you are targeting May INI set, how your roadmap should look like. Now, coming to the second category of students who are less than 25, who have got rank above 25,000, 30,000, 40,000. So, ये वो category of student है जो बहुत devastated feel कर रहा है, and they are messaging to us continuously that is there any scope for us to be a top ranker in INI set of May 5th May, the exam which is going to be held in 5th May. So what do you say? Should these students appear for May INI set exam if rank is above 25,000?
I'm a very optimistic person, actually. And I believe that never say never. And actually, even if someone thinks that, okay, I'll not get a rank, what the way I think at it is, at least you'll get a real exam practice.
Exactly.
Because see, we give GTs, but there's a difference between GTs and the real exam, right? What happens in real exam is your hormones and neurotransmitters, they come into play.
Right.
Your adrenaline is high. And that does not exactly happen in the GTs.
In the GTs.
So you'll at least get a real exam practice. And भाई ठीक है, चलो नहीं होगा ना, आखिर में होगा क्या? INI सेट में नहीं होगा, पर INI सेट की तैयारी में कुछ सीखोगे तो सही।
Exactly.
जो आगे चल के आपको नीट पीजी में आपको काम आएगा, right. तो बेकार कुछ नहीं जाएगा। तो right. तो उसको ऐसे लोग, एक पड़ाव है, INI सेट मेरा एक पड़ाव आने वाला है, देखते हैं क्या होगा। उसके बाद जो है मैं नीट पीजी तक अपनी प्रिपरेशन, I'll keep on continuing after that.
Right, sir. So, sir, same, I believe what you are saying is absolutely right. At least they should appear for INICT to get the, to get over that anxiety of giving an exam. But again, these are the category of students who should target, जिनको exam देना है May का, but उनका target होना चाहिए November INI set. So, ये वो category of students है जिनकी rank above 25,000 है. They should target November wala INI set. They should give May INI set, but they have to target November INI set. And sir, I have chalked out a plan for them that how they should revise at least 3 times before November INI set. So, sir, if you allow me, sir, I'll just tell them some detailed plan.
Please go ahead, man.
So, students, jinka aaya hai rank between 10,000 to 25,000, and you are first attempters and you want to give this INI set, you have a very bright chance of getting very good ranks in INI set of May 5th. Now, for you people, please remember, INI set and NEET में there is a big difference in the pattern of the exam. INI set focuses more on first year and second year subjects, whereas our NEETPG focuses more on third year and final year subjects. So, सबसे पहले starting from tomorrow, which is 16th of March, you are going to start revising your first year and second year subjects. Now, when you are revising your first year and second year subjects, you are going to focus on MCQs. You are going to do MCQs of first year and second year subjects. You are going to do PYQs, and you are going to revise those areas which are very volatile. What topics, what tables which you tend to forget in first year and second year subjects. And I'm sure, sir, so like you are there, a master in pharmacology. So you will definitely agree that pharmacology mein there are many volatile tables which they need to revise every day. And you are also putting up schedules for pharmacology, how they should be taking up pharmacology weekly schedules.
Yeah, no, I do that weekly pharmacology before every exam. And that is how we can break down pharmacology into bits and pieces and cover them gradually. And that should be done specifically for those subjects which are volatile.
Yes.
Or any subject you find difficulty in. So we should not take it head on rather than break it down into bits and pieces. But here I'd like to tell one thing, that whenever you prepare for INI set, there are pet topics, specific topics, but you cannot just, do PYQs and think that you'll get through. No.
Yes.
The PYQ will be repeated. I'm telling you, will be repeated, but with a slight mutation. Right? The mutation will be so small that your eyes cannot catch it, and the answer will change. Which means what? You have to master not only the PYQ, so that if it is repeated, you will answer it rightly, that everybody has to do, but you have to master the topics as well. Like for example, let me say, in G Pharma, they'll ask you about P glycoproteins. P glycoproteins, like the inducer or inhibitor, etc. They do ask specifically in INI set. About the rate of absorption, extent of absorption, specifically they ask in INI set. Clinical trials, they are asked. So there are specific, and I have given you a list. I've given a list of drugs like amiodarone, drugs causing QT prolongation, and valproate, theophylline, and I've given you this list. I posted this on Instagram as well. You can go to my highlights and see LMR, and you'll have at least 50% of the drugs that I've given you. You'll have questions from these, which means what? These are the frequently, asked drugs or topics. So one thing, ma'am, that students, they ask me, sir, how to know which topic is important for the exam in any subject, or which drug is important for the exam. So it's a very simple logic. I ask the students back, if I make you an examiner, let us say, I'll ask the student, I'll make you an examiner, and where would you ask the question more from? The common diseases or the rare diseases? Is simple thing.
Right.
From commonly used drugs or rarely used drugs. So the answer is pretty clear, right? So from that. So anyways, you have to be bullish on the PYQs, but not only on the questions. When I say PYQ, I mean the topics. You have to have a grasp of that topic. And if you're not comfortable with that topic, then this is one aspect when we used to go to standard textbook. Like when I was preparing for All India PG, back then it was called as AIPG, not NEETPG. Now let us say, for example, hyperkalemia is a very important topic. It was important in our times as well, right? So if I'm not, for example, I was not able to solve the questions right on hyperkalemia because the topic is pretty confusing. When you need to give calcium, when you need to give insulin. So what I did is I went back to Harrison and just read that half a page of hyperkalemia. So selectively, so if you're not getting your concept clear for that topic from anywhere, selectively you can go and study a little bit from any standard textbook. But remember this thing: nobody studies standard textbook cover to cover for NEETPG, right? If someone says he studies cover to cover, means he has studied only cover, right? So nobody does that.
Right, sir. So my thing was that you start from 16th of March, that is tomorrow, and till 10th of April, please target your first year and second year subjects. And the way which sir has discussed, in a retrograde manner, focusing on important topics, not just important PYQs, but previous year topics also. Now, from 10th of April to 30th of April, you should target your third year and final year subjects. So by 30th of April, you are done with one revision of first year, second year, third year, and your final year subjects. Coming from 1st of May to 4th of May, you should restrict yourself only to PYQs and only to the volatile topics, which you should write somewhere that these are the tables, your 20th notebook, which should be present with you, that these are the topics, these are the points which I'm going to revise before I sit for the exam. Now, this is a very sound plan for all students who are getting a rank within 25,000, but they have a doubt that they are not.
Ma'am, one second. Dr. Utsav is joining us.
Oh, great, sir. So please.
Sir, namaskar.
Hello, sir.
Hi, sir. Good evening. Good evening, ma'am. How are you?
Good evening, sir.
So
Thank you for giving us your valuable time.
It's a pleasure to have you.
Thank you, ma'am. Thank you, sir.
So, ma'am, please continue. We'll also ask sir about the ophthalmology part in a short while.
Yes.
Please continue, ma'am.
Now, suppose your rank is above 25,000. Like some of you were saying, ma'am, my rank is 50,000. My rank is 40,000. How should you go about? See, definitely you have to appear for INI set June exam, a May exam. But then your basic target, your main target should be the November INI set exam. And what you should aim is that from 15th of March, starting from tomorrow and going up till June 30th, which means you have pretty 3.5 months in hand. April, the entire month, May, entire month, June, entire month, you should complete one complete reading of all subjects. You've already done that before. Now you just need to revise, but this time your revision is going to be with MCQs and with concepts. Please do not mug up things. Please do not just focus on PYQs. Now, in these 3.5 months, you are going to focus on concepts, and by June 30th, you are going to complete entire course once. Starting from 1st of July and going up till September 15th, you have 2.5 months comes your second revision. And then starting from September 15th to October 30th is your third revision of 1.5 months. Right? So 3 revisions you are targeting before November INI set. So this is how students who have attained a score, a rank above 25,000, this is how your timetable should look like. This is one of the ways. No, I'm not saying this is a foolproof method, but this is one of the methods which you could follow. So we also have Dr. Rohan with us.
Yeah, Dr. Utsav, sir, I would like to ask one question related to INI set, because we're talking now about INI set. Then I have another couple of questions for you as well. Number one, for INI set, do the student need to do something different for INI set, for ophthalmology point of view?
No, sir. I think essentially the NEETPG ophthalmology preparation and the INI CT remains more or less the same. Obviously, as I think it is with all the other subjects, it is with ophthalmology also. That the questions do become a little more clinically oriented or conceptual.
Yeah.
Right.
But as I heard, ma'am, and you were saying previously, the basic again lies in the concepts. If your concepts are clear, then probably you can answer a fact-based question as well as a clinical question. This has more to do, I think, with the phobia that the students have of this word that has been created probably
so
by us
we
only.
have here.
Hi.
Hi. Hi,
Hello,
Ranjan.
Hello,
Hi, sir.
sir.
Good evening, sir. Good evening, ma'am.
Good evening. Good evening.
Hey.
Yes, sir. Please continue.
So yes, I was saying, so I think it's more to do with the phobia that's probably been created in the students' minds regarding the fact that clinical is different.
Okay.
So I always tell my students, you are going to become clinicians. If you're going to become clinicians, then being afraid of clinical questions is like, it doesn't make sense. So I think if you have clarity on that, it's all about the mind. Your mind can do wonderful things. Apart from that, as far as INI-CT is concerned, always be prepared that you will never be able to solve all the 6 questions from ophthalmology. So INI-CT in ophthalmology is famous for giving.
If it is said by the AIMS guys.
Yes,
guys are known,
absolutely.
They are known to
be notorious on this.
Weird MCQs on ophthalmology, even for art.
Right. So, I expect this, that I won't be able to do one question out of the 6 hours, very frankly. So, I will also have to search, sir. So that is the kind of acceptance you need to bring into the mind. Ki, bhai, aisa hoga.
Okay, sir. Rohan, sir. Again, the same question to you, Rohan, sir. Ki, INI set, keeping INI set in mind, does the student need to do something different from surgery point of view?
So, sir, first of all, मैं बातें सुन रहा था that we were talking about November INI-CET. Why are we talking about November INI-CET when May INI-CET is a month and a
Sir,
half
we
away?
said, no, sir, it was, I think, sir, you joined,
Sir,
you
being
joined in
realistic.
between. We said that students, you have to give May INI-CET, and that is because you are going to give that as a practice, and but then your main target should also be November INI-CET if your rank is 40,000 and 50,000 as of now. That doesn't mean you are not going to give May INI-CET. For them, for that, we've already discussed the plan, sir.
Okay, so for surgery, I think so the repeat questions are more frequent in INI-CET as compared to NEET-PG. This time NEET-PG was an aberration where more repeat questions were asked in surgery also. So INI-CET, the distribution section-wise is very different as compared to NEET-PG. So trauma, emergencies, general surgery, they pay more attention. Of course, since the last two INI-CETs, they've also been paying attention to GI surgery. So if they focus on the previous year topics and the questions, I think so they should be able to do surgery part and just the revision videos. Plus there is one surprise which we'll be releasing in the first week of April in surgery for them. If they just do that much, that should be enough for them.
Okay.
Sir, I have a question for you. So a question which was repeatedly being asked, and that is that their ranks, the scores which they were getting when they had calculated their scores themselves, looking at the recall videos, or when they were giving their GTs, they were expecting a score somewhere around 400, 500, but now when they look at their actual scores, it is 250, 300, 370. So how to deal with this kind of discrepancies?
So, ma'am, first of all, recalls can never be 100% accurate. Okay? Because it's like Chinese whispers. 300 क्वेश्चन याद करके कोई भी एग्जैक्टली करेक्ट बाहर नहीं आ सकता. फिर वो बाहर आता है तो एक टर्म चेंज होता है, बाहर आते आते दो लाइनें चेंज हो जाती हैं, तो क्वेश्चन का मीनिंग ही चेंज हो जाता है.
Right.
So we can't be 100% relying only on recalls. And I just spoke in a video. I said that the first thing, जो भी हुआ है, there has been a failure, right? And the sooner you accept that failure, the better it is going to be for them. Because if you keep yourself in a state of denial and you keep on blaming other people for your failure, आप आगे नहीं बढ़ पाओगे. So पहले accept करो failure को, फिर analyze करो अपनी mistake and फिर आगे बढ़ो. That is the only way to go forward.
Ila ma'am,
yes,
the
sir.
same question to you for INI-CET, from INI-CET point of view. Would you like to advise something different to be done from pathology point of view?
Sir, pathology, though, it's all about now clinical pathologic correlation. So I would say that keep doing your medicine, surgery, and pathology together. Plus PYQs. So this year also in NEET-PG also, a lot of students messaged that pathology was one subject which was a little easier because a lot of PYQs were asked. And there was not even a single question which was a bouncer this time from pathology. Although we expect in NEET-PG there are one or two questions which are from a very, very different topic. But NEET-PG was very simple. In INI-CET, the trend is always PYQs for the past 5 years. So revision and PYQs plus images. That
in
is
and around the PYQs, we have to move.
Yes,
so,
yes.
Sir, actually,
so my one question.
Right.
So I am just interrupting you in between because I'm just looking at the questions which students are also sending. So there is a category of student who knows that where they were lacking, they weren't able to complete their subject, or they didn't give enough GTs, or they didn't do enough MCQs. That is one category of student who know where they were lacking and they know that they have to focus on these areas now and they are going to improve. But there are some students who are saying that we've given our best effort, we've put our best foot forward, we have given GTs, we have done MCQs, but still during exam we made silly mistakes, and now we don't know that what else to do. So what do you think, Dr. Ranjan?
Ma'am, it's all about, ours is a difficult exam for the sheer vastness of each subject, and the number of subjects are also not limited. It's 19 subjects.
Right.
So the basic problem is on one single day, on that one day of exam, you have to converge this much of information. Let us suppose we have. So you have to convert that information and you have to go into that single day. And that is only possible. That is only possible if you strategize. Right. So, and all students are different. Like one might remember a lot of information from first reading. One might take 2 or 3 readings. So they have to analyze what kind of student they are. And based upon your weakness, you have to plan yourself. So for example, this is one strategy that I tell all the students. Every day keep 1 hour for revision. Because usually what happens is you complete a subject. Completing a subject is not important. How much you remember after you have completed it is important. So I tell them every day keep 1 hour at least for revision and use 45 minutes of that 1 hour to revise whatever you have studied yesterday, and use that last 15 minutes to re-revise or overlook whatever you had studied the day before yesterday. So it goes in triplet. Like you read, you revise, you re-revise. And yeah, this is something I used to do because it's basic physiology. Like if you keep on repeatedly doing the same thing, it goes into your permanent memory. So that's the thing you have to do. And there was a student who secured a rank of around around I don't remember, around 30,000 or something like that in AIPG at that time. And then he asked me that then there used to be state PG exam. And then he asked me, sir, what should I do? Because I've done everything. I've done everything possible, but I'm not able to get down my rank to a good rank because I want orthopedics. Then I advised him to revise like this. Right? Whatever you studied yesterday, revise today and re-revise whatever you studied day before yesterday. And that guy came rank 60 in Tamil Nadu PG from somewhere around 30,000. Rank is the same student. The same notes. The only way, the only thing that changed was the way to approach the revision. Right. So you have to increase your retention. But let me tell this, ma'am, it is not easy. Every day you'll feel, why should I give 1 hour to revise something I've studied? You'll think, let me study something new. Let me study something new in that 1 hour. Right? But you have to realize the benefit of this. Once you keep doing it, you'll keep enjoying because you'll retain a lot of stuffs. And maybe Rohan sir or Utsav sir can add something to this, how to improve the ranks, despite they've done everything, GT, QBank, everything, but still rank is not improving.
So I think here somewhere from my personal all India exam experience, obviously I am an ophthalmologist, so I didn't get a 2-digit rank. Obviously that is pretty clear. Otherwise, I probably wouldn't have been an ophthalmologist. I think acceptance is the key here. So if you think, if this is the feeling, if a student is there, a particular student, and he or she feels that, it's been 2 attempts or 3 attempts, and probably in the last attempt or this attempt, they have given their best that they could, then somewhere this acceptance needs to kick in. It's all right that in life, with all the life goals, with your biological clock and everything, time is also of importance. We cannot keep running after something which is eluding us, which can be due to any reason whatsoever. And then probably make the best of what you have right now. Till how many years? If it is your first attempt, if you have given your best, you think, but you still probably can, try to better your best for another year, right? You can talk to some people. We are talking to you. There are some other seniors, some other faculties, some friends you can talk to. You can probably try to find out your deficiencies, work on them, and the results will be there. Hard work never goes to waste. But if it's your second or third attempt, then I personally, that's my personal view, that acceptance should be the answer and not finding what we can do better.
Rohan sir, one question for you. Sir, students are asking about first aid. That should they read first aid now, because they've already done whatever source they were relying on, they've already done that. Now there is a lot of noise about first aid. Should they go for first aid now?
So first aid, actually, INI CET, the main differentiator are the first and second year subjects. That's what we always say, that the main rank determinators for INI-CET will be first and second year subjects. And first aid part 1 is more useful for first and second year subjects. But just first aid alone is not enough. When you add more information to it, when you underline and make it more comprehensive, then it is more useful. With only 6 to 7 weeks left for the exam, I would not recommend any student to pick up first aid right now if they haven't marked it. If again they are preparing for November exam or for next year's exam, then definitely I feel there is an advantage in doing first aid, provided they add more points to it and they make it more comprehensive. In short, it is going to be your 20th notebook for first and second year subjects.
So actually, sir, if I look, this is what I understand about first aid. You get first aid book, you go through the PYQ.
Yes, I
then
can hear you.
Then annote the PYQ in the first aid. Now go through all of this trouble when you have, like, for example, rapid revision videos where it is already annotated that these are the PYQs which has been asked, right? So I think that in that case, the rapid revision videos or the notes would be more productive. So Utsav sir, there is one question. Right. There is one question I would like to ask you. A student has also
Dr.
asked.
Ranjan, sorry, I'm interrupting you. Ila ma'am has joined, and if you can please add her.
Ma'am, I am trying, पर वो join नहीं हो पा रहा. मतलब इसमें क्या 4 की limit है?
I think, okay, sir. I think there can be maximum 4 joinees. So I am leaving. I will be available on the chat so that Ila ma'am can join.
Okay. नहीं, ma'am. आप बैठो, आपको रंजन सर का सेशन था, हमने तो गेट क्रैश किया है.
Not made and Ranjan sir, the students want to listen from you, from Utsav sir.
No worries. Me and Dr. Ila can be together. We can be sitting together and we'll address them. Nobody needs to leave. We'll just adjust that. You people carry on. I'll just call Dr. Ila.
Okay, so Utsav sir, I would like to ask you one thing. That this is something I intended to ask you as well, and some student has also commented.
Right, sir.
That if someone has no interest in ophthalmology, someone wanted like medicine or OBGY or anything, right, clinical subject, now he or she is not getting that branch of choice. Now, is it advisable for someone to take ophthalmology who has no interest whatsoever in ophthalmology?
Right, sir. So I can see this question posted by a user Asthash5.
Yeah.
And there were 2 other questions which said who should take ophthalmology. So I'll just address it very quickly. So Asthash's question, do you suggest to opt for ophtha who has no interest at all in the subject? So it is not only for ophtha, it is for any other subject. I will say, if you don't have a interest in the subject, don't take it. Again, you have to live your whole life. You have to do justice to that. Why I took ophthalmology? Because I always wanted to take a microsurgical field. So I was, since my third prof, ophthalmology interested me. It's not that it was a forced choice on me. Yes, obviously forced choices can be there, but if you have no interest at all, so I was pretty clear I cannot take PSM. So that was the only subject I was pretty clear I will never take, due to whatever reasons, I don't know, that many years back. So I could probably take pharmacology or anatomy, but I was not ready to take PSM. So if you don't have an interest, don't do it. It's your life. It's not 3 years of post-graduation. It's 50 years of your life. So never take that. Now, as far as who can take ophthalmology, anybody can take ophthalmology. The pros of ophthalmology are a very good work-life balance. I don't have emergencies. You will not have emergencies. The basic con of ophthalmology as to who cannot take is a high cost of setup. Unless you have a lot of money to, establish your practice, at least in metros, in Delhi's, Bangalore's, and, all the tier 1 cities, jobs are scant, and establishing your practice takes a lot. So those are the only 2 deciding factors. These days, females are coming more into ophthalmology than males. This is the recent trend I have seen. I think, again, because of the work-life balance. I think that's more or less, I think, about ophthalmology in a nutshell.
Same question to you, ma'am, regarding pathology. If someone is, let us say, hell-bent on taking a clinical subject, but it's like 2nd or 3rd attempt, and like he's not getting, he or she is not getting, the clinical branch, and like people do think that there is some kind of clinical, attachment in case of pathology, microbiology. So should everyone go for pathology if not getting any clinicals?
Sir, diploma in pathology is a strict no.
Okay.
DNB in pathology only from a very good institutes in which there is a lot of workload.
Okay.
And then MD in pathology, I would say for men and boys, I have seen them struggling and cribbing later on. So I tell a lot of students that, especially boys, that please think twice before taking pathology. Because there were 5 people with us, and all 5 of them were always unhappy after taking pathology because they thought the department was totally women oriented and a lot of women were there, and then there was no clinical exposure. Then regarding otherwise, sir, the same points which Dr. Utsav said, excellent work life balance, and it's a great branch. I mean, I took it by choice, not by chance. So if you love Robbins, you can think about it, because amongst the paraclinical subject, I would say that this is one branch which still has some clinical component. I mean, we talk to the patient, we see their history, and sometimes we go to the wards, and then we can do bone marrows and all these biopsies and all. So it still has some clinical element.
Yeah, definitely.
So,
Definitely. I mean, two branches like radiology, pathology, they might seem off clinical, but you need to have a hell lot of a knowledge about the clinical subjects for doing the right reporting.
Yeah.
And surgery, I won't ask Rohan sir, because a surgeon is a born surgeon. So you cannot make a surgery. He or she is a born surgeon. So guys, now
so one question which we are getting is that students who who haven't been able to clear their NEETPG this time, and they have to start preparing again. Now they are just confused whether it is going to be NEET or next. So is it going to make any difference in their preparation? Even the students who are going to enter into internship, because we are not very clear about NEET or next, is it going to make any difference in the way they should prepare? Rohan sir?
So ma'am, I'll talk about that, but one more thing which I want to talk about is, look, there are right now 3 or 4 kind of students. One category is those who have got a good rank and they will get their desired branch, right? They have 2 options in front of them. Either they wait for the NEETPG counseling to happen and they enjoy for 3 months. They live their life before the real grind starts for them, okay? Option number 2 for them is to prepare for INICT and do the same branch from a central institute. Second category are those who know what is their desired branch, but they are not sure whether they'll get it at their rank or not. Now, these are people who should definitely prepare for INICT, because they have done something correct. They just need to build on it, and if they build on it, they can probably get the same branch in INICT or in a central institute. Third are those where the rank is not good. They might get a compromised branch, right? So there my suggestion is that if it is your second or your third attempt, and if that branch was your second choice, you should definitely opt for it. Keep preparing for INICT, but you should opt for it, because it is only going to get tougher in future. And after 2 attempts, we've usually seen the productivity starts reducing.
Right.
So that is number 2. One more suggestion to those people, not a popular suggestion, but a practical suggestion. Some students do message us saying that we can afford a deemed branch, we can afford a private institute. If you can, go for it. There is no harm. I mean, if you can get your desired branch, again, I'm saying not a very popular statement I'm making, but a practical statement.
Yes.
Third are those students where the rank is 60, 70, 80,000. They are clueless regarding what is to be done. Again, my suggestion would be the same. If it's your second, third attempt, if you like some other branch, please take it. A lot of students are messaging about pharma, about microbiology, pathology. Please take it. Pharmacology, I feel, should be one of the top branches one should consider, right? So many pharma companies are willing to pick you up. you will get paid more than what a resident doctor or a postgraduate gets after doing post-graduation for at least 5-6 years. You can set up your own business. There is tremendous growth there. So pharma, PSM are excellent options if one is getting them. So also one more thing is, I think so we need to tell students to get out of that traditional mindset ki we only have to do medicine, surgery, obs, gynae, optha, ENT. There are other options as well. One should start exploring them, especially if 2-3 times, like Dr. Utsav was saying, ki 2-3 times you have not got your desired thing. So then it's time to improvise there. Coming to your question, whether NEET PG or next PG, for me personally, it does not make a difference whether it's NEET PG or next PG, because the concepts are going to remain the same. Yes, if it is next PG, some subject weightage is going to change, but I'm sure the authorities will give students a reasonable heads up for them to prepare themselves.
All right. So when someone is asking what is the scope for pharma later in life, see,
Yes.
I've made a detailed video about scopes of pharma. There are 5 to 6 different aspects of pharmacology. Please go to my YouTube channel. Was that because I called one of my seniors? And I made a video with him because he is currently associate professor in LHMC. He has worked in pharma companies. So that's the purpose why I called him. So just go to my YouTube channel, just search Ranjan Kumar Patel, and pharmacology is a branch. You'll get that video, you'll get a nice idea about salary, work-life balance, everything, man, we have discussed over there. So please go through that video.
Sir, I would like to just pitch in. A lot of students are asking here about DNB and stuff. And usually it is the mid-rankers like 10 to 20,000 who are, eternally stuck in this, I think sir is, okay. So who are eternally stuck in this, condition that they are not getting a MDMS. Now they are thinking whether to join DNB or not, or whether to go for diploma. Obviously, I'll be talking in general about all the branches, but more so specifically about ophthalmology. So first, ophthalmology. As far as ophthalmology is concerned, I think it's a disclaimer which a lot of students don't understand or don't know, that ophthalmology DNB is probably better than 90% of the colleges that offer MD ophthalmology or MS ophthalmology, right? So Arvind Pondicherry, Shankar Netralaya, LVPEI, these are the best institutes possible for ophthalmology after probably AIMS and some other major government medical colleges. So just to look down on DNB because DNB has not been made famous by the previous generation doctors, or it was in that way that it was, in 2000s, early 2000s when we were preparing, DNB did not have an entrance exam. So just because of that, in the early 2000s, it used to be looked down upon. Does not mean it is bad. If I have to go back, if I was told this, if somebody had told me don't take MS ophthalmology, instead of that, do a DNB in ophthalmology from any of these prestigious institutes, I would love to go back to that era, and I would love to, correct that mistake that I probably did by not knowing this. As far as DOMS goes, somebody had asked what are the opportunities after DOMS. So after diploma in ophthalmology, the only drawback I would say is that if you want to get a job as a senior resident in any of the government medical colleges, or if you are looking to get a professorship or AP or whatever in colleges, you are not eligible. So the way out of that is, if you are doing DOMS, then be prepared that you are doing private practice, right? Yeah. So DOMS, private practice. Then, because in private practice, nobody is looking at your degree. They are looking at the clinical skills that you have. Or after DOMS, then the other way out is you do secondary DNB.
Right.
Secondary DNB exam is just like the NEET exam that you have given right now. It's probably 10 times easier than NEET PG and NEETPG. Secondary DNB exam, you clear that, then you do a DNB again. So basically, instead of 3 years, you are spending 4 years in doing your post-graduation. 2 years of DOMS and 2 years of secondary DNB. And after that, you are treated equally at a level of an MS in every college. And at a lot of places, you are even given preferences, because essentially you have spent more time than a MS, 4 years instead of 3 years. And I think this holds true for almost every branch. Sakshi ma'am, Ranjan sir, and Rohan sir will be able to comment more on that. But the only thing is you need to choose, or you need to be aware of the institutes, because in DNB, a lot of bogus institutes are also there. Bogus in terms of where, you're just getting the DNB degree or diploma, but you're actually not being taught. So if you are aware of the branch you want to take, just spend a little bit of time, ask us, and note down the good DNB institutes, and take them with all the guts you possible.
Sir, like you said about DNB, I've already discussed DNB OBGY versus MDMS OBGY versus DGU. So in the beginning only we have discussed. So all the students now who are asking about the scope of DGO, who are asking about whether they should take DNB OBGY or not, in the beginning of the discussion only I have addressed this, that DNB OBGY from a good institute is better than MDMS OBGY also at some places, because the hands-on practice which you get in your in peripheral medical colleges, government medical colleges, you don't get a lot of hands-on on laparoscopic surgeries. But when we talk about DNB, in DNB, in good, if you're doing it from a good hospital, a lot of hands-on practice you get for laparoscopic surgeries. And I also told them, sir, that this is a myth that it is very difficult to clear DNB. The pass percentage in DNB is now increasing, and it's not difficult to clear DNB if you have got a lot of hands-on practice, a lot of patient practice. But then, as you said, for D-ortho, I also say for DGO, if it's your second or third attempt and you really want to take up gynae, go for DGO. If it's your first attempt, don't go for DGO. If it's your first attempt, I would want you to prepare again and take either MDMS gynae or DNB gynae, because once you take DGO, like you sir mentioned, that again you will have to clear DNB, secondary DNB, which is going to again take 2 years. But yes, in your private practice, it is not going to matter much, because some of you might go for these fellowships which are available in infertility and other specialties. So that is not going to matter much in your private practice, especially if you are not practicing in a metropolitan city. Some corporate hospitals, if you are only DGO, they might have that hitch of hiring you unless and until it is DGO and DNB, secondary DNB, right? That is one drawback in metropolitan cities in corporate hospitals. But in private practice, it really doesn't matter. But first attempters, I will not advise you to take DGO. Second and third attempters who are very much interested into gynae obs, go ahead with DGO if you are getting that.
Till the time sir is joining, there is one student, Shankar BC, who's asking again and again. I'll just reply that he has a tremor in his hand. Should he take ophthalmology? No, you should not. You should not take any microsurgical branch if you have a tremor in your hand, and if it does affect your day-to-day life motions, because in microsurgical branches like ophthalmology with tremors, the surgical part will become a lot difficult for you to do.
So let me try to add some students. Actually,
sir, please.
Sir का जो है ना hang हो गया है.
I think Rohan sir is back on the screen. I can see.
Sir का hang हो.
Yes.
So अभी मैं लेता हूँ किसी student को. Let me take some students.
हाँ जी.
Rohan sir, a lot of students are asking about surgery. कि how to rank the colleges for surgery.
So there are actually 3 videos on my YouTube channel, and I would strongly recommend anyone who's planning to take up surgery should watch those videos. One is surgery as a career option, in which I've spoken about DNB versus MS 6-year courses. Then, and I've also spoken about how to rank tremors, color blindness, whether you should go for surgery or not. All those things I've spoken about. There's another video which compares only DNB 6-year courses and DNB versus MS. And the third video is for females who want to take up surgery as a career option, where I had a session with 2 leading surgeons who shared their views.
So one student has joined and she would like to ask some of her doubts. Please introduce yourself, doctor.
Yes. Please.
Hello, sir. I'm Dr. Ruby Agarwal from Allahabad. Sir, I was a user of Marrow. Sir, I want to know what are the scope for radiation oncology as a branch?
So again, the radiation oncology, emergency medicine, nuclear medicine, all three videos are there on my YouTube channel. And radiation oncology is a great branch, upcoming branch, stable branch in which growth is stable. I mean, it's not as if you can put your own setup. So you'll be working in a corporate hospital or a government hospital. There is stable growth. The fears for ladies that, radiation exposure is there and pregnancy, all those are uncalled for because the department is very understanding. And, if you become pregnant, they give you adequate leave and adequate precautions are taken to prevent you from
And sir,
radiation exposure.
between radiation oncology or ophthalmology, which would be better option?
I think so. It's like comparing apples with oranges. One is a surgical branch and one is a non-surgical branch. So it depends on your interest. Like Dr. Utsav said, Optha, good combination of OPD versus OT. Scope for growth is more in Optha as compared to radiation oncology.
Thank you, sir.
So tremors, color blindness, whether you should take up a surgical branch. Well, I always feel one thing that rather than thinking about yourself, think about the patient. So if you think your handicap is going to affect the patient's outcome, then you should never take up a surgical branch.
So one question which their students are asking again and again, Dr. Ranjan.
Yes, sir.
Will next occur in 2024? I think you can give a blanket answer on that. I think there is no answer, but I think you are the best to explain.
No, sir. Frankly speaking, as far as I know, I mean, and I can see it because it needs a lot of preparation. Conducting a next exam, frankly speaking, even they're barely scratching their heads to conduct NEETPG. Barely, they're able to conduct the NEETPG, do the counseling, server crashes. Conducting next is such a big scale. So many undergrad students would be there, FMGs would be there. Next one, then next. So I don't think they will conduct all of a sudden next. What I see is they will conduct next one and NEETPG simultaneously for at least 2 years. I think that is my personal opinion, and then they would merge them so that one they are confident about conducting the next one, because it's a very big challenge. But anyway, sir, you never know. Modi ji hai, kuch bhi ho sakta hai.
So basically, everyone is in the same area of darkness regarding next.
Yeah, nobody knows
for all the students.
Until
Exactly.
unless you get a notification, nobody can say for sure. But Rohan sir has already said that we do not need to change our preparation strategy. Even if next happens, they'll not ask about rocket engines or anything, something like that. So it'll be about medical science only. The way like they ask, it might change. And there is a saying in English that when things change too much, they remain the same. So that is what might happen, I think. So,
Dr. Rohan, there is a query for you. I think you would like to take it up by Dr. Nishtha. Is DNB surgery better than MS surgery from a private institute?
So DNB and MS now, the discrimination is much less than what it used
MS
to
from
be
a private.
back. And if you're doing...
No.
That's, I mean, in general, I'm saying, so DNB, okay, DNB versus MS from a government institute and DNB from Gangaram. If you're doing MS from a peripheral institute versus DNB surgery from Gangaram, I would any day opt for DNB surgery Gangaram, right? Now, DNB from a lesser known place, a private institute versus MS from a private institute, you have to compare the workloads. You have to compare how the previous, batches have fared, how they passed, where are they currently, and then you have to take a call. Somebody has also asked, only MS, no super specialization. What is the scope? Again, I've addressed this in detail in that video, that only MS also do very well. Even in Gurgaon, where I practice, I know 4 or 5 plain MS. They, of course, know laparoscopy very well, and they are earning equivalent to what a super specialist would be earning. So there is still scope for a general MS as well. provided you have good skills and good patient
So guys who
communication
want to
skills.
join the live session and ask their doubts, right? You can put your requests and I'll add you guys.
Sir, I'll be taking a leave for some time, and then if required, I'll join back, sir.
Okay, sir.
सर आप मोदी जी के साथ पपुआ
के साथ
सेशन कब
मोदी
कर
के
रहे
साथ
हैं? हाँ,
मोदी सर देश में रहने दो, आप कहाँ देश छोड़ के भागना पड़ेगा।
तभी तभी तो नेक्स्ट का पता चलेगा हमें।
मैम को ऐड कर लेता हूँ क्योंकि बच्चों का जितना ज्वाइन करा था उन्होंने कर लिया मेरे ख्याल से।
So foreign nationals would have to clear the FMG exam. At least FMG, I think so, will happen till December this year. Post that, if next happens, then that would be your de facto FMG exam.
Sakshi ma'am, let me make you join, ma'am. Sakshi ma'am.
Gaurav, I think so. We've already covered mid-rankers 10 to 15,000. If you should definitely be preparing for INI CET, and if you are it was your second or your third attempt, then try to take up a branch this year. Jaya, general surgery versus orthopedics also, there is a 25-minute video on my YouTube channel where I was the surgeon and I was with an orthopedician who is my senior from Safdarjung, and we've debated all the pros and cons regarding this. So you should go through that video on my YouTube channel.
Hi. So what's your name? Please introduce yourself.
Sir, I'm Soumya. Sir, Rohan sir, we met in our college. You came to BPS. I'm good, sir.
Hi,
Sir,
Soumya, how
actually,
are you?
I am a final year student. I know this session is for those who are going to attempt INSET. But sir, with the speculations of next coming, we still don't know. And we just heard somewhere that maybe in December next will be happening. Well, there are speculations. So what is the approach for final year students? Like we have this thing like the third year weightage is now different. And the ENT optha questions, the weightage, the number of questions will now be more. And so how should we, in this short span till December, organize our study pattern?
When
Sir,
does your
it's
final year get
in
over?
December only, November, December, May, sir, we'll have sent-ups and then.
So that's what I'm saying. So unlikely that the exam will be in December, because what they've said is that they'll at least give a 2 to 3 month period post the final session
Yes,
getting
sir.
over before your exam happens. Okay? Any which ways, the
Yes.
maximum weightage is for final years, right? So final year की तो अभी you
Yes,
keep
sir.
on studying for that, उसी की तैयारी करो. बीच में तो
Sir,
और कुछ
like
थर्ड ईयर की तो तैयारी करोगे नहीं. और जो गैप मिलेगा उसके अंदर you prepare whatever you have to prepare when the notification comes. अभी तो
like
we have no clue
third year
regarding
we studied
whether it's
from
going to happen.
Marrow, and final year we've been studying in third year and final year as well. But with first year we studied it mainly from the books, mainly for the professional point of view. So how do we approach that? How do we study the first year subjects, and what approach do we need to take for that?
See, first year.
So they've said that.
See, pre-paraclinical, the first year and second year, right? If you have studied textbooks, and I would suppose you had a good hold over those subjects, from exam point of view, right? Exam point of view, third year, final year, you should go with the main videos, and you should be, well versed with these clinical subjects. But for the first year, second year subjects, you can use the revision videos in Marrow.
Yes.
They're detailed, and at the end of the day, you are a doctor, right?
Yes.
It's not that someone is asking you to study about first year, second year subject from for beginning. So for a first year or second year, revision videos are not good.
Yes.
But for you guys, in a lesser amount of time, how can I score more, keeping my
Yes.
clinical aspect intact, plus doing first year and second year? Revision videos should be your go-to tools.
Okay. Thank you so
Sir,
much.
I will also add to this that, sir, it mainly depends upon how good hold you have on first and second year subjects. Mostly what happens when you are in your first year, it's you are not that attentive during your lectures, and your physiology still you understand, but when it comes to anatomy, when it comes to pharmacology, which are highly volatile subjects, right, you don't tend to remember them as good as you should when you are during your internship. So if I would have been in your place, yes, like sir said, revision videos, I would have watched revision videos, but then I would have felt little more confident if I would have done it in a retrograde manner. I would have taken up the custom module, the Q banks, and through Q bank, I would have seen what are the questions which I am making wrong. Yeah, even after reading the explanation, if I'm not getting how to attempt, I'm not understanding that question, I would have watched that video. So I would have taken it up in a retrograde manner. I wouldn't have felt very confident appearing for NEET or appearing for INICT just by watching the revision videos.
Yes, I'll just give you a simple. I'll just give you a simple example. In pharmacology, you'll have MCQs from lithium. You'll have MCQs from amiodarone. You'll have MCQs from theophylline. And now when you're practicing MCQs from these drugs, which they are going to ask,
yes, sir.
And if repeatedly you're not able to wrap your head around that why you're not able to solve the MCQs right, in that case, what you can do is go back to the main videos in Marrow and just do that drug lithium, which is the most high. But if you're able to do the questions right, if you're able to do the questions right on lithium, whatever they ask in the Q bank, in the GTs, if you're able to do them right, then it's okay. You can go with the revision video. So you can be selective. So, there is no set formula for everybody. You cannot paint every student with the same brush, right?
Right. The second option could also be that you can just go through the notes. Go through the notes without watching the Wayne videos. If there is anything in the notes which you are not understanding, then watch the video. That can also be one of the strategies.
Yes, ma'am. Thank you so much.
Most welcome.
Radiation oncology, Tejas, is not a 6-year course at AIMS. Jodhpur, I'm not aware of a 6-year clinical oncology and radiation oncology course. I know that radiation oncology is a separate 3-year branch. This is the first time I'm hearing of a 6-year course in that.
Okay.
And someone was asking about radiation oncology and ophthalmology. At that time, we were talking about, and I feel that with radiation oncology, you have to be limited to larger cities, I think, the opportunities. With ophthalmology, you can small places also you have, job opportunities.
So now even tier 2 cities, there are radiation oncology setups which are coming in. So anything related to oncology is going to boom in the next 10 to 15 years, sir. So I think so anything related to oncology is a branch of the future, and one should strongly consider it if they are interested.
Great. So I cannot find, sir.
That's
Anyways.
okay. Sir, I think we have addressed most of the queries related to preparation strategy. As far as comparison of different branches is concerned, I think that's a different discussion altogether.
Hello. Hi, sir.
Hi, welcome. Please introduce yourself.
My name is Dr. Munu, and I am an FMG. I wanted to know how to use Marrow for NESET November preparation.
Okay, so just give an idea about how much have you done from Marrow until now? How much have you?
I haven't started. I want to start now for next exam or for NESET November.
You're preparing for NESET November.
Yes.
Yeah, so very good. Dr. Rohan is the best person to give that answer. Rohan sir, bataiye.
So November INICT, you've already cleared your FMG exam, na? Perfect. So I think so you need to build on that. Did you use Marrow for FMG
I did not.
also? Fine. So whatever source you utilize, you just need to add on to it. And INICT typically asks a lot of questions which are repeat. They have set questions, set topics from which they ask. So whatever previous notes you have, you get a list of these topics and you keep on adding these topics to them keep on expanding, and do more questions. So the main difference for you would be that you'll need to solve more questions which are being asked in INI-CET. So the more number of questions you do, read those explanations, whatever extra is there, keep on adding it to your notes. Simultaneously, keep on maintaining a separate register where these previous year questions, the volatile points you keep on adding, which you need to revise at least 2, 3, 4 times before the exam. So that's
So
the
can I
only
Yeah,
thing
exactly.
add
you
to this
should be
once
doing.
something here?
Yes. Sure, ma'am. Please go ahead.
See, when you are
Yeah,
preparing for FMGE, you are not preparing for an exam where you have to get a rank. You are preparing to clear that exam, right? And
Yeah.
that is one thing. So many times what I have seen for FMG students, they rely on to very quick resources, short resources, where you are not understanding the concept, but you are visiting those topics again and again, like, the mugging up, the chanting sessions which are held for FMG students. You are relying on them and you are not building your concepts. So this is something which you have to analyze, whether your concepts are strong or whether you cleared FMGE because you had done some quick methods to clear that FMG exam. Now,
Understood.
there are subjects, like you said, you are preparing, you are going to aim INI set, but I'm sure you are also going to appear for NEET, right? Just in case you are not able to clear your INI set. So although in INI set, first and second year subjects are important, but for NEET, it is the third and final year subjects which are important. So if I would have been in your place, I would have utilized this time to build my concepts in at least some of the clinical subjects which are very scoring. Surgery, for example, which in Marrow is crisp. And if you study Rohan sir's video, if you watch those videos, I mean, I am not just bluffing. I'm not just saying because Rohan sir is here. I always say this, that you will be able to solve 100% questions from the videos which you see, if not 95% questions if you go through his videos. So watch all videos of surgery because that is how your concepts in surgery will be strong. In OBGY, I would again want you to watch videos if your concepts are not strong in OBGY. If you cannot watch all videos, then in that case, go to the revision videos. In revision videos, we take up important topics, right? We exclude the unimportant topics. So make a list of those important topics which I have touched in the revision videos. And those topics, main videos you watch.
Okay, ma'am.
Right?
So basically, let me summarize. Let me summarize. You have the notes of 19 subjects, right?
Yes.
You know where do you stand in that subject. You have revised it multiple times before FMG exam, right? You know which subject is enough, which is not enough. And when you'll realize that, when you'll solve the PYQs of INI set, and when you solve the Q bank in Marrow, right? So use Marrow Q bank religiously, use the PYQs of INI set. Now what happens is, when you're solving, you'll find a lot of topics missing in your notes, because INI set some topics are important, they are not important for FMG. So you'll have to separately add those topics, and you can add those topics from the explanation of PYQ in the Marrow app, right? So by that you can complete your notes. If you find that it is too haphazard to add, just go to the main videos or revision videos and do it from there. So basically, 19 subjects, you don't have to do it from scratch, but wherever you have gaps, you just have to fill up those gaps, right?
Okay, what if I passed my FMG in 2019?
Okay.
And I had this gap years in between. So how to go for INI-CET now? Like, I should prepare from Marrow, or I should go for my FMG notes? What should I be doing right now?
Now see, I'll tell you, see, what happens is, for short subjects, right? Short subjects, even FMG notes are good enough. But you still need to add. You still need to add, even in short subjects.
Okay.
But I feel subjects like Marrow, medicine and surgery, OBGY, this constitute a huge number of MCQs. And in FMG, whatever medicine, surgery, or OBGY you must have studied, I don't think, because in that, if you want to add, it would be too much of a task, hell of a task to add, because these subjects are vast in themselves. So if you make yourself oriented with medicine, surgery, OBGY, so you can do that from Marrow, the clinical subjects. Other subjects, as I said, look at your notes, do the PYQs. You'll be able to do some of them, 40 to 50%. Others will not be able to do because those will not be covered in your FMG notes. So you just need to add them. If you feel that you are going no way with your notes, just do it fresh, start afresh, right? So just use some of your experience from FMG, put some from Marrow, make a blend, and you'll be ready to go. But give an honest attempt for INI, but in the back of your mind, keep plan B, that is NEETPG, right? Because NEETPG, the number of seats are more, so there is always a chance that you'll get your branch of choice in NEETPG, right? I said you might get something, but the branch of choice can become sometimes tricky, right?
Okay. Thank you so much for giving time.
Most welcome. Bye bye.
Chile, sir,
I think
will
we should
take
also
your leave.
end this session because most
have
of the questions, the relevant questions related to preparation strategy and wherever they wanted us to help them, I think we addressed all that. Now it's basically the choices, the branch choices which they are asking and the cutoffs. So I think that can be addressed in some later videos, sir.
Yeah, we can do another session regarding that.
As it is, ma'am, we have planned about a detailed session about the INI set and all. We'll later let you guys know about the detailed session about how to prepare and the schedule and all. So we might come live sometime, right?
Just one word before leaving, that like success is not permanent, even failure is not permanent. So please don't take this failure to your heart. Just take it as a stepping stone that maybe, you are going to do something better in your future. That is why this failure has come. Don't take it as a roadblock. Just keep on moving ahead. And whatever mistakes you committed, everyone knows that what mistake they had committed. So whatever mistakes you had committed during your preparation, work upon them. And it's the same advice which everyone gives. Give your DTs, make your concepts strong. And there is no other success mantra. It is always these things which even the toppers are doing, which even you have to do, but now you have to do in a smarter and a more diligent manner.
Usaf sir, closing words.
Oh, okay. To all the students who have not got the desired rank, just one word. I think one word should be sufficient. That is hard work. Just don't feel demoralized. Keep working hard. Keep doing what you are doing, and that is why you have got the rank that you have. You just need to do that a little better. Don't lose heart. Work hard. That's all.
Rohan sir, your final words.
Sir, I think so. We have discussed. So those who've got a good rank, congratulations. Those who've not got a good rank, accept what went wrong, analyze what went wrong, and start preparing again. If you don't want to prepare, take some other branch and move on. If it's been 2 or 3 attempts, my genuine advice is that take up whatever you're getting if you want it. Otherwise, think about
Yes, my closing words. If you're still depressed about the exam results and you're not able to make a head start, what we Indians do when some things don't work, like a computer or a washing machine, anything, we switch it off, then switch it on, right? Restart, basically. That is what we do. Because that is the thing that works 90% of times. So you just need to restart yourself, take a break for 1 week, go to some place. I don't mean Switzerland or go to some relatives. मामा के घर जाओ, चाचा के घर जाओ, कहीं भी जाओ, but just change your place. क्योंकि वही माँ बाप की शक्ल देखोगे, वही तुमको घूर के देखेंगे, रैंक नहीं आया, तो फिर वो डिप्रेशन होगा. So just go to one place for 1 week, relax, talk to some people whom you know, your relatives, etc. Then come back after 7 days, and you need some time to think back, right? And then you will bounce back. And we're always there. You can DM any one of us. We're always ready, eager to answer all of your queries. And from time to time, we'll keep on coming live to enlighten you with this. And I'd like to thank sirs and ma'am for their valuable time to guide all of you. Thank you, ma'am.
So last question to Rohan sir.
Thank you for allowing us to gate crash your
session.
So
how is there so much of glow on your face? हाँ सर, so ये question आया सर आपके
ये मैम ये लाइट लगाई हुई है
ये
सामने
रोहन सर का योगा का कमाल है।
योगा
योगा और
कुछ
क्रिकेट का
सर,
कमाल
कभी
है
आप स्विमिंग कर रहे होते हो, कभी आप क्रिकेट खेल रहे होते हो।
मैम स्विमिंग तो अभी स्टार्ट होगी, अभी तो
मतलब
योगा और
all
क्रिकेट चल
three
रहा
of you are fitness freaks. Great sir.
मैम सर का अपने फिटनेस वाले फंडे हैं, हमारे अपने फिटनेस वाले फंडे हैं।
मैम आप अब 50
सर
पुशअप
थैंक
कर लेते हो 2
गॉड।
मिनट में,
सर
हम
मेरे
तो
को
उतने
लगा
नहीं
कि
कर पाते।
मैम आप 50 साल की हो गए हो। मतलब आई जस्ट
लग यही रहा था।
नहीं नहीं
सर लग
I
यही रहा
said-
था। मतलब आई वाज लाइक सर ऐसा भी नहीं है।
नहीं, मैं तो 50 पुशअप कह रहा हूँ।
ओके चलो
ओके सर, बाय
Okay,
बाय मैम।
good night.
बाय बाय
चलिए, ऑल राइट,
Take care,
गुड
sir.
नाइट एवरीवन,
Bye.
गुड नाइट,
लॉस ऑफ लव
बाय।
बाय बाय।